Hi everyone, welcome to the Module 5 introduction video where we'll be going over what you need to do to prepare for this week's module. First off, we'll start in the lecture course. We do have our fluid and electrolyte lecture. When you click on the page here, you will see the prep work that you have to get ready for the week. We have a quick introduction in the blue here, a little bit about fluid and electrolytes in the green there. We have our objectives here in the gray, and then we have all of our lecture materials, including the key concepts, the chapter. Please note that in the chapter, we do recommend skipping ABG or acid-base balance and IV information because that is part of your Block 2 content. So go ahead and read chapter 40 and make sure that you're skipping those things in there. Then we have our notes that can be filled out as you're watching the lecture video here. The video is approximately 1 hour, so I would recommend taking frequent breaks. Maybe do one section, take a break, do another section, take a break. Make sure you're doing that so you're not losing yourself while you're watching that 1 hour video. It's an extensive video there. And then we have these pathophysiology concept maps. These are probably a little bit different than what you're used to seeing. And let me just make sure it's opening here. This is the pathophysiology concept map, and please feel free to use it, or you can create your own. You can, use part of it, adapt it to whatever works best for you. But basically, in the middle here, you're going to put the disease being the fluid and electrolyte imbalances that we will be talking about. So something like fluid deficit or fluid overload, you could put in the middle here. You can also put hyperkalemia, hyponatremia, any of the diseases or processes that are going on in the body would go in the middle here. Then you're going to go up and do the signs and symptoms. How would you know that the patient is having that? Those are those priority cues that we've been talking about. What would the patient present with? Any risk factors that puts a patient at risk for the disease itself, potential complications if not corrected. We have our nursing diagnoses that are important to determine, what is the patient's response going to be to that problem that they're having. And then the nursing interventions would go here. You can also do some medical interventions, labs, and diagnostic studies on this side. And you can see the arrows are directing you to make those connections between the sections of this concept map. So like I said, use it if you'd like. If you'd rather use your own, that's perfectly fine as well. Okay? And then as we move down here, we have some additional supplemental videos. I did try to find videos that would help because I know sometimes hearing it in different ways from different people can be very helpful. These two people here do great videos, and he talks about, fluid and electrolytes easy here, and then how to memorize them. And he goes through both of these videos here. It's actually the same guy, but he talks differently about different things in each of these. Then we have our picmonics here if you'd like to go through some picmonics. We have some additional picmonics here and the PowerPoint from the book if you'd like that. And there are quite a few additional resources here. Please don't feel like you have to use any of these. You can pick and choose what works for you. Some of them are games. Some of them are extra PowerPoints that I've used in the past. Some of them are study sheets that I found to be helpful. Just extra resources, guys, but please don't feel like you have to print all of these, use all of them. It's really just to help meet all of the learning needs of all of the different students. We also have the test your knowledge down here. You can drag, and do these activities down here if you'd like to try them. This one has about 5 questions in it, so you can try doing those and going through each of those. And then that is all of your prep work for the lecture. There's only one chapter, but it is a pretty extensive chapter, and there's a lot of content that needs to be reviewed. So once you finish that, make sure that you also complete the hybrid module, which is on the next page here. And this module has quite a few areas to review as well. Patient rights and ethics, legal abuse and neglect, professional standards, system-based practice, and evidence-based practice. So make sure you review these before exam 2 because these will pop up there on exam 2, okay? All right, so once you complete all of that, you can go ahead and go over to the lab section. The lab section, you're gonna find your prep work for lab, and that is going to be the practicum skill. So we will be introducing you next week to your practicum patient and getting you ready for your practicum that's in a few weeks. What's really nice about the lab is all of it is already stuff that you've done. So it's review, and that's just wonderful because I think you could use the time in the lecture portion. So you have all of this stuff. It's all review, guys, that you've done. So here's the chapters again, the vital signs, the health assessment, which you guys are getting really great at. Here's a video that an instructor completed on a physical assessment practicum. So this follows the rubric that we gave to you guys a few weeks ago. So you want to make sure that you watch this video. If you click next here, you will see, once again, yay, the pre-work's been done. It's all review. It's just putting together the PO medications and the injection medications. And we are going to talk to you guys about filling out the drug cards, those cards that you can bring in with you as reference during the practicum. Here is your patient, Alfreda Morales, and that's your practicum patient with her MAR, okay, and the rubric. So you have all of that there. Here's the chapters. You've already read these, guys. So, use your time wisely. If you want to review, that's great. If not, make sure you're just looking at the practicum medications. In addition to watching this video here, which is a faculty performing the practicum going off of the rubric. So if you watch this is a great video. One of us is doing that for you guys in that video. And then here's just how to make a label in case you're wondering, how do I best label my injections or my medications for my practicum? Once you've done that, guys, you're done. So going into Lippincott, let me show you, as a reminder, how to find the assigned readings and activities. So go ahead and hit launch on the Fundamentals of Nursing book. Remember, you can go two ways. You can go through assignments, where you just click on assignments and you'll see the ebook and anything else. Here's the PrepU that's recommended. You'll see it in there. Another way, as a reminder, is you can go into the content area. You can find the chapter, which on the side here are all the chapters right here. So we see chapter 40 is under unit 6. We click on chapter 40, and then we can see what's assigned in there. So here's the ebook, and then here's the PrepU. Here's another little activity that you can do. We have, this is for your cardiac lecture, so it's coming up a little bit later in March, but you can always try those if you'd like, but you don't talk about those until your cardiac lecture. So these three things up here would be the best things to review. You can also see any other activities that you want to look at in here. Okay, a lot of chapter 40 has to do with IVs and things like that, so make sure you're not spending time looking at that because that's block 2 content. Alrighty, so I think that's it in Lippincott. There'll be some other chapters assigned and activities, obviously, for the hybrid material, but just to get you started with your fluid and electrolyte, here it is. And then once you go to start to prep for that hybrid, they'll all be assigned to you. All right, guys, see you in lecture.